Did you know that many women experience skin breakdown, bladder leakage, vaginitis, and weakness of the pelvic floor after spinal cord injury? But they don't realize that these issues often get worse once women enter perimenopause and menopause. Hi, my name is Anita Kaiser, and this is episode 3 of the podcast series Menopause and SCI in a Hot Flash, where we'll talk about skin and vaginal changes during perimenopause and menopause. I'm here with my colleague, Margaret Conquest. Our guests today are Lisa Beck and Marinelle Laguna. Lisa is an assistant professor of nursing at the College of Medicine, Mayo Clinic. She is a board-certified clinical nurse specialist provider in the spinal cord injury program at the Mayo Clinic in Rochester, Minnesota, with a focus on SCI clinical care, education, and research. Marinelle is a nurse practitioner at the University Health Network's Toronto Rehabilitation Institute Lyndhurst Center. She currently leads UHN's first nurse practitioner-led outpatient clinics for pelvic health and skin and wound care. We're delighted to have you both with us for this episode.
Thanks for having us both.
All right, let's first start by talking about skin. So for those of us who have a spinal cord injury, we're often dealing with different skin-related issues, pressure sores, injuries, cuts, burns, all due to lack of sensation. Aside from all of that, what are some of the skin-related issues that a woman might experience once they reach perimenopause or menopause? I noticed my skin in general started to become much drier in my late 30s, and I started having folliculitis on one side of my bum and extreme dryness in my 40s. Are we dealing with the same skin-related issues in perimenopause and menopause as we did post-spinal cord injury, or are there new issues?
Really great question, Margaret. As we know, skin is a vital organ, especially with people with spinal cord injury. Unfortunately, these are new issues for women. As they go through perimenopause and menopause, there's a reduction both in estrogen and collagen. And these are important hormonal substances for our women or for women with spinal cord injury, because estrogen helps skin produce oil and hold on to water. With the reduction of the estrogen, we're going to see drier skin, thinner skin. And then the collagen gives that skin the plumpness and structure. So with the reduction of collagen, we're going to see fine lines, wrinkles, sagging. We lose that suppleness of skin and the pliability. So it really puts women in the perimenopause phase more at risk for pressure injury, bruising, skin tears, and even some women have a harder time healing wounds.
Yeah, I'm definitely noticing the drier skin just in general all over my body. And I also find it's taking longer to heal from even like very small skin injuries now compared to 10, 15 years ago. Of these issues that, you both just described, which ones do you see as being the most often in your practice? And which are the symptoms actually that women complain about the most?
Related to the thinner, dry skin that doesn't have elasticity, seeing more women who have been really successful at protecting their insensate skin in their 20s, 30s, and up until mid-40s. This is where they're starting to find more pressure injuries.
Yeah, I definitely see dryness and slow healing as well. I see a lot of women with fragile skin, especially around the sacrum and sitting areas. I see little scrapes that can turn into something more serious, especially if they're not caught early. Folliculitis is also something that comes up, especially in those high pressure or low airflow zones in the bum. And I'd say women are really surprised by how quickly their skin starts to feel more papery and thin once they hit around their 40s and 50s.
That definitely aligns with what I've experienced. So Lisa, what are some of the treatment options available and things that women can do in their daily self-care to manage or prevent some of these bothersome changes in their skin?
Prevention is a key element here, and really to be aware, number one, of what your skin looks like. So if you can't see your skin yourself, I have lots of men and women that take pictures of their skin so they know what their skin looks like. And it's not just those bony prominences, especially as women are aging. Within the perineal region, slide board transfers, sometimes they're hitting labia, sliding over the slide boards. So visual checks of your skin daily. Hydration is so important. having a good nutritional diet, limiting your sugar intake, your alcohol, caffeine intake, as well as limiting ultra processed foods, being very cautious with transfers. And I really recommend seeding clinic assessments. So making sure you map well and are getting good pressure relief in your seeding system.
That's great. Great information. So spinal cord injuries wreak havoc on our bladder, and many of us that have been living with a spinal cord injury for a while now have been dealing with multiple urinary tract infections over the years, as well as incontinence and bladder and kidney stones. So what's different about all of that once a woman reaches perimenopause and menopause?
In menopause, the estrogen levels drop. And when that happens, it's like pulling support beams out from under a structure. So things are going to start to shift. The pelvic floor sort of loses its tone and drops, which changes that angle of the urethra. And that can make catheterization trickier. So finding the urethra becomes harder, especially with reduced sensation that some women with spinal cord injury experience. Other changes are more bladder leaks and UTIs, plus the natural vaginal flora or microbiome shifts, which impacts vaginal pH. And so there's a whole system that becomes prone to recurrent infections, dryness, and inflammation. And as you've mentioned, Anita, there is potential for bladder and kidney stones. When hormone levels drop, it can lead to changes in urine concentration and stone formation. Some women might notice more urgency, incomplete emptying, or even discomfort that gets brushed off as normal aging. Even hydration balance gets a bit trickier. Some women start drinking less water to compensate for some of the changes they're beginning to notice, like leaking, but that can backfire because concentrated urine can irritate the bladder and then raise the risk for infections and stones.
So I started to actually have unexplained recurrent UTIs in my early 40s. And then it progressed from there where I had a lot of pain inserting catheters and finding my urethra later on after I'd had my hysterectomy. So my doctor early on prescribed Vagifem a couple times a week, which is a little estrogen tab that goes into the vagina. And later on, after my hysterectomy, when things got a little more progressive, it was increased to 3 times weekly. And then I was also coached along with all of that about lifestyle changes around about soaps, fragrances, even the types of wipes I was using when cathing. I also added a pea-sized amount of Premarin cream to the urethra and clitoris 3 times a week to address the issues around cathing. I did try hydrophilic catheters, but my hand function wasn't. I did try hydrophilic catheters, but my hand function was too big a barrier for them. Are there other treatment options that you think women can consider?
Great that you brought that up, Margaret. I'm so glad you were able to see firsthand the difference that some of these treatments can make. Local estrogen therapy like Vagifem tablets or Premarin cream can really be a game changer when it comes to preventing UTIs and improving comfort in the vaginal and urethral areas. They help to restore healthy tissue. They support natural pH and reduce the friction and irritation that so many women experience with catheter use or even just with daily hygiene. Also, a bladder-friendly diet, like cutting back on things like caffeine, alcohol, and spicy foods, can really help to reduce irritation to the bladder. Some women also benefit from things like vaginal probiotics or cranberry supplements, which can help to reduce UTI recurrences. And of course, there's regular voiding and gentle hygienic practices. But that being said, it's always important to speak with a doctor about other tailored options like estrogen therapy and pelvic floor therapy. It's important for a clinician to actually identify the problem and then tailor your treatment accordingly.
Yeah, those are all great pieces of advice. Specifically, what are the vaginal issues that a woman would experience both post SCI? And then I guess what's different once a woman reaches menopause?
After a spinal cord injury, many women deal with reduced lubrication, lower libido, and altered sensation. And then menopause tends to worsen all of those symptoms. So we start to see more vaginal dryness, which can lead to micro tears, friction injuries, or bleeding with sex, or it can even cause, in general, day-to-day discomfort. Another thing women experience is that touch may feel less pleasurable or not register at all, which of course affects how women experience intimacy.
After I healed up from my hysterectomy and ovary removal, I started having a lot of discomfort with sex. I had zero fluid and lubrication. And then the labial dryness got to a next level kind of dryness, cracked and bleeding labia. And even my doctors were surprised to see that. And then I also started to experience recurrent yeast infections. And of course, my sensitivity to touch was a whole lot lower and my orgasms disappeared. The Premarin cream actually helped quite a bit. At this point, and this is fairly recent for me, yay me, my orgasms are back. I did have to work with my partner on new touch technique. We incorporated silicone-based lube because water-based lube wasn't doing it for me anymore. So it was a group effort. What other treatment options can you say are helpful for your patients?
First of all, that's so great to hear and good for you for advocating for yourself. But the first thing I would say, I guess, is to always discuss this with your doctor, whether that is your family doctor or physiatrist, and if your primary care provider is a nurse practitioner. But it's important to really have your symptoms assessed properly and of course, your lady parts examined. Your doctors can connect you with specialists like a gynecologist or urogynecologist for a full pelvic exam and history. The key is really having a team that's checking in regularly and adjusting the plan according to how your needs evolve.
So, one of the things that you just spoke about was having and the importance of having a pelvic exam. So I just wanted to dive into that a bit further, Mary, now, what about the pelvic floor?
Absolutely. The pelvic floor is like a hammock that supports the bladder, bowel, and your reproductive organs. So anatomically, women have a wider pelvis in comparison with males. This subjects us to a weaker pelvic floor. In spinal cord injury, though, the pelvic floor muscles become weakened and uncoordinated. And in menopause, there's further muscle thinning and decreased tone. So symptoms of incontinence, pelvic organ prolapse, and sexual dysfunction may start or be exacerbated. But there are treatments like pelvic floor muscle training and biofeedback that can really help even in women with partial or altered sensation. These therapies can help strengthen and retrain the pelvic muscles to help improve bladder and bowel control and potentially sexual function.
Yeah, so you just mentioned about prolapse. Is that really a common issue with women?
It is common. Globally, about 40% of women will experience some form of symptoms of pelvic organ prolapse. And in women with spinal cord injury, that number climbs to about 71%. So prolapse happens when the muscles and ligaments that support the pelvic organs, like the bladder, uterus, or rectum, weaken or stretch. That causes those organs to drop into or press against the vaginal wall. It's especially common after things like vaginal childbirth, particularly if the delivery was prolonged or the baby was large or if forceps or a vacuum were used. So for women with spinal cord injuries, the risk is even greater for prolapse. That's partly due to the weakened pelvic floor muscles and partly because experience from chronic straining during bowel routines, especially those with conus or cauda equina spinal cord injuries.
Yeah, I wasn't even aware about prolapse until I experienced it myself. I had a long labor when I was pregnant with my daughter and vaginal delivery. And then I was diagnosed with a prolapse soon after that. And it did get to a point where at times I guess my cervix was exposed. So what are some of the treatment options that are available to manage symptoms or even to correct the issues of these different types of prolapse?
For milder cases, topical estrogen and pelvic floor therapy can offer some relief. We also can use things like pessaries, which are sort of small devices inserted into the vagina to support the prolapsed organs. If symptoms are more severe or interfere with function, like bowel and bladder function, surgical repair is also a potential option.
So throughout this podcast series, we've noticed that a lot of the menopausal symptoms we talk about reduce or disappear with time. What I'd like to ask both of you is if there are things we've talked about today that get better over time with treatment, or do they get worse?
I'll just start out related to skin integrity. And unfortunately, Skin does not get better over time. As we age, we continue to lose collagen and estrogen. What I would like to suggest is, as women have aged through their spinal cord injury or spinal cord dysfunction and doing very well, having a green light on their skin integrity, sitting on different surfaces, doing a variety of activities. Now consider your skin on yellow light more on caution and be more aware of what you're sitting on, how you're sitting. Has your posture changed over time? Double check in yearly or every other year with your seating specialist, making sure you're mapping well on your surfaces. So just being cautious.
I would definitely echo what Lisa said, but I will say that vaginal tissue can regain moisture and elasticity with the right support, like estrogen creams and good skincare. UTIs can become far less frequent with a combination of hormone therapy, hygiene tweaks, and prevention strategies. And sexual function can also improve, especially if communication is open and the partner is on board.
Yeah, and I feel like we've touched on this a bit throughout the podcast and talking about how all of these different changes can impact people's quality of life and experience in their relationships. Can you speak a bit more about that?
Well, certainly pressure injuries definitely affect quality of life. But again, prevention is key. And with a relationship, that open, honest communication is so important. And being willing to try different positions, maybe even different surfaces, using satin sheets underneath, just to avoid some of that shearing and friction during intercourse. Just being willing to try different things. And again, reminding yourself you're a little bit on caution on your skin integrity.
To add to that, I would say these changes affect everything for sure. Your mood, your self-image, how confident you feel in your body, and a small skin tear or a leaking bladder can really derail somebody's whole entire day. And intimacy, that often takes a back seat when women are experiencing these issues.
So can you guys tell me, what questions should women be asking their healthcare provider when it comes to their skin, bladder, and pelvic health?
We didn't even mention this, but sunscreen protection is so important as we continue to age and protect our skin. And when any changes occur on your skin integrity, you should go and see somebody, a trusted provider that can help you with skin management, wound care, and again, your seating clinic specialist to help offload that area of concern.
When it comes to skin, bladder, and pelvic health, women should really feel empowered to ask their doctor simple but important questions. Things like, could my symptoms be related to menopause? Or even asking something more specific like, could this pressure or bulge be a prolapse, can really open the door to more helpful solutions with your healthcare providers. And honestly, if something feels off, whether it's discomfort, leaking, recurring UTIs, or changes in sensation, that is the time to check with your provider. The earlier you bring something up, the easier it usually is to treat.
So to end things off, what final message would you want to leave our listeners with?
You're not alone. Changes will happen. Talk about it and show it to a trusted healthcare provider.
If you found today's talk interesting, check out our action planning tool on the website at www.scifragments.ca and feel free to send us your feedback using the survey provided on our website. In the next episode, we'll talk about osteoporosis and its effects on menopause. Special thanks to the Paralyzed Veterans of America Education Foundation grant for funding the podcast series Menopause and SCI in a Hot Flash. This podcast series is hosted by Dr. Anita Kaiser and Margaret Conquest. The executive producer is Dr. Kathy Craven, and co-producers are Dr. Anita Kaiser and Dr. Hope Jervis-Rademeyer. The production team includes Dr. Kathy Craven, Dr. Hope Jervis-Rademeyer, Dr. Anita Kaiser, Margaret Conquest, Dr. Masai Miyatani, and Dr. Lindsay Blanco. Sound design is by Dr. Hope Jervis-Rademeyer. This project team is affiliated with the University Health Network in Toronto. We appreciate the feedback from people with lived experience who acted as podcast reviewers and helped us to refine the podcast content over time.